the title, What Can I Do? How to Confront, Address, and Prevent Disruptive Behavior and Bullying in the Workplace. We selected it because we felt it was important to look at this issue from a proactive perspective and to talk about how to equip and empower ourselves with the skills and the confidence to take actions towards addressing this type of behavior in the workplace. So in employee relations, we're very passionate about this topic because a big part of our job is to develop programs and tools to help staff in maintaining effective relationships at work. And unfortunately, in our role, there are times when we've encountered interpersonal conflict situations that have been left unresolved for so long that formal intervention it becomes necessary, and that's a lot of times when employee relations will become involved. And we really think that had a lot of the strategies that we'll talk about today been used in those situations, that it may have resulted in a much more positive outcome for all parties. So I'll hand it over to Colleen to give an outline of today's presentation.
So on the screen, you'll see a general outline of today's presentation, and we'd like to first cover some of the definitions of bullying and disruptive behavior, what it is and what it isn't, as well as review a few examples of each. Then we'll discuss some of the facts and statistics about how this important issue is currently presenting itself in the workforce, specifically in healthcare. We'll focus a lot of attention on prevention strategies, such as how to personally address and prevent bullying in the workplace, and we'll also place an emphasis on the role of the bystander. Then we'll review some of the tools and resources that are available in our organization, and then go to the room for some questions.
So before we begin, I wanted to share a personal story from when I was first starting out in my career. And I was just finishing off my education, and I was placed in an organization for a co-op experience. I was very, very enthusiastic and eager to share my big ideas with everyone. And our team was in a team meeting one day where we had a guest that was invited from another department. We were discussing ideas, and I just decided to share an idea of my own. And my manager then turned to the guest and said, "Don't listen to Tara, she doesn't know what she's talking about." Well, I was devastated by this comment. I completely shut down as a result, and I decided never to speak up in a meeting again. I was humiliated in front of my colleagues and the guest, and because it was my first true work experience in the organization, I lost a lot of confidence in myself and in my abilities. Now, this may seem like a fairly minor event in the big scheme of things, but I am me, and I am very sensitive, and I'm very self-critical. And I thought about this incident for years after it happened, as it left such a strong impression on me. I think I went through all the stages of grief and anger, self-hatred, confusion, back to anger, and then more of an acceptance and a learning from it. But I spent an extraordinary amount of time reflecting on what I needed to do differently myself in my professional life, and I really regret not having approached this person to talk about the event. I'm going to go into this a little bit later in the presentation to explain exactly why I regret this so much. I'm sure that everyone in this room has an example of being at the receiving end of some type of disrespectful behavior or even bullying in the workplace. And we want to invite you to think about an example while we're going through our presentation today and reflect on maybe what you did to successfully resolve it, where you maybe attempted to resolve it and it didn't maybe go as planned, or maybe you didn't do anything at all and you really wish that you had. And we really hope that what we talk about today will help to get you thinking about how to approach these situations in the future. So before we go into the AHS definition of bullying, we thought it was important to talk about other inappropriate types of behavior which can often be mistaken for bullying but actually fit into a category that we call disruptive or disrespectful behavior. Disruptive behavior is personal conduct, words, actions, or inactions beyond that normally accepted as respectful interpersonal behavior. which disturbs the work environment and or potentially poses a risk to the delivery of safe and quality health care. Now, bullying and disruptive behavior can have a lot of similarities and on the surface can appear to be the same. Disruptive behavior could be disrespectful or offensive comments, maybe rude public displays, inappropriate nonverbal communication like rolling your eyes or turning your back on someone or glaring at somebody. But the key differences between disruptive behavior and bullying is that disruptive behavior is more of an isolated or short-term event or incidents, whereas bullying is a repeated pattern of behavior. But even if certain behavior doesn't necessarily fit into the category of bullying, it may still not be acceptable in the workplace, and it still needs to be addressed promptly and appropriately. And in fact, it's really important to address these behaviors that we find disrespectful, as they could turn into bullying if there's no intervention. So all of the prevention strategies that we will be discussing today can be effective for managing disruptive behavior as well as the behavior that turns into bullying.
So it's important to differentiate between bullying and bullying and a person's legitimate authority at work, because all employers have the right to control how work is done and provide feedback on work performance. So we have a few examples of what would not be considered bullying or disruptive behavior in the workplace. And that would be directing or controlling how work is done, providing guidance, direction, or coaching to improve job performance or correct work behavior, conducting performance evaluations based on work performance, enforcing workplace policies and procedures, denying training or requests for time off for operational reasons, dismissing, suspending, demoting, or reprimanding for cause, monitoring workflow and assigning work that's operationally reasonable and relevant to someone's job function, or differences in personality or work style. So for instance, there's a difference between a management style, such as a direct message that a staff member may not agree with, versus bullying, harassment, or misconduct. We're now going to review a brief workplace scenario. Jason's an experienced nurse who has been on the same unit for a number of years. Recently, a new manager has sat down with Jason to suggest that he take a course on effective communication. Jason's never heard concerns like this in the past, although he is a straight shooter and he hasn't always seen eye to eye with his coworkers. Jason disagrees with the feedback and feels that his manager may be bullying him and is considering a few options for proceeding. On the screen, you're going to see 4 possible options that Jason's considering. And as we read through the possibilities, we'd like you to reflect on what option you think he should take in this situation. Either filing a formal complaint, going to colleagues to see if they also have similar concerns about the manager, ignoring the situation and hope it gets better, or approaching the manager to seek clarity and ask for some specific examples of the concerns. Jason ultimately decides after further reflection that the best approach would be to set up a meeting with his manager to gain a better understanding of the concerns. So he approaches the conversation in a calm, professional, and open-minded manner and asks if there are any examples the manager can provide to him to help him understand the concern. The manager provides 2 examples of incidents where she directly witnessed Jason being overly confrontational and oppositional with colleagues, and she gives him an opportunity to provide his version of events. The manager also provides Jason with an opportunity to identify any supports that he may require moving forward, and he ultimately acknowledges that he may have some room for improvement in his communication style. At Alberta Health Services, it is a recommended best practice that performance feedback is provided in a constructive and objective manner that provides suggestions to help the employee improve and uses concrete examples to clarify expectations. It should not be subjective or use personal insults or derogatory remarks. So if employees are ever concerned or confused about performance feedback they're receiving, they're encouraged to meet with their manager with specific questions planned out ahead of time, such as what Jason did. HR can also be a good resource for assistance with tips or suggestions on how to manage conversations or concerns of this nature.
AHS defines bullying as the activity of repeated, aggressive, or disrespectful behavior intended to hurt another person physically or mentally. Bullying is characterized by an individual or individuals behaving in a certain way to gain power over another person. So power can be formal or informal. Formal power is based on a hierarchy structure, like between a staff member and a supervisor or manager. Informal power may involve someone having maybe a higher level of seniority, specialized skill set, or maybe just access to specialized information that other employees don't have. But regardless of whether they have formal or informal power, the key is that it creates an imbalance of power between the perpetrator and the target. Bullying can also be categorized as either vertical or lateral. Vertical bullying is between people of different levels on the staff hierarchy. So it can either be top-down from a supervisor to a staff member, but it can also occur up the hierarchy from a staff member to their supervisor or manager. And some examples of top-down bullying might be intimidation and abuse of legitimate power, like threatening or implying unjustified discipline or job loss. Setting someone up to fail, like excluding them from vital communications that they need to do their jobs, or criticizing or belittling someone in front of others. Some examples of upward bullying behaviors might be intimidation or threatening. For example, I'll file a harassment complaint against you if you give me a poor evaluation or deny my vacation requests. Undermining or criticizing a supervisor in front of others. Uncooperative behaviors like chronic lateness or refusal to follow standard procedures, or organizing a group of colleagues as a form of mobbing. Now, upward bullying is often disregarded or even swept under the rug because there is a tendency for us to believe that it's part of a manager's job to tolerate disrespectful behavior, and this is especially when it comes in the form of a formal complaint. But at AHS, all staff are expected to act and communicate in a respectful manner regardless of their position in the organization. Lateral bullying occurs between peers at the same level, and some examples of that type of behavior might be insults or put-downs directed at an individual, ignoring, embarrassing, or belittling someone, purposely excluding or isolating someone, withholding critical information from someone that's vital for them to do their job, of course, spreading gossip, rumors, false accusations, or purposely undermining or sabotaging someone's work.
Before we move on to recommended strategies, we wanted to first review a few facts and statistics about how bullying is presenting itself in the workforce. In the general workforce across various industries, approximately 1 in 6 people have been bullied in their lifetime. Bullying is often more prevalent where one gender is predominant, such as in the nursing profession. Bullies are often smart and use their power to create an unequal playing field. Less than 15% of people who are bullied go to their managers to ask for help, and unfortunately, up to 80% of individuals who are bullied will find another job. We're now going to talk about how bullying is presenting itself specifically in the nursing profession. So on the screen you'll see the slide where we're asking what percentage of LPNs who recently responded to a CLPNA survey indicated that they've experienced abusive behaviors from another nurse. And we'd like you to take a moment and reflect on what percentage you think is accurate from those listed on the screen. Approximately 80%, 50%, 70%, or up to 85%. Now imagine that almost 9 out of 10 of your coworkers have experienced bullying or abusive behavior at some point in their career, because that's exactly what the survey is indicating. This is an extremely high number, and it's significantly higher than the overall average for other workforce environments that we've previously stated. Here's a few other examples and facts, I should say, about how bullying is presenting itself in the nursing profession, specifically within LPN groups. 70% of LPNs surveyed reported experiencing intimidation or other forms of abusive behavior as students, and that could be by practicing nurses, instructors, or other team members. And almost 90% witnessed abusive behavior among their nursing colleagues. Within nursing, the main perpetrators are often nurses in senior positions or established staff members. Those most likely to be bullied are often students or new team members. High-stress environments such as complex, acute, or critical care environments or environments that value technical expertise over emotional intelligence often exhibit higher bullying rates. Unfortunately, very few targets or bystanders go to their manager or report the behavior. According to the previously mentioned CLPNA survey, it was reported that 60% of LPNs surveyed did not report the abuse. So their question remains, if the issue is so prevalent, why is it not being reported? Sometimes bullying may go unreported as a result of not being recognized or being passed off as simply the way things are, or even a personality trait, especially by those who are not the ones being targeted. It may be addressed in statements like, well, that's just Doris. She's set in her ways and knows her job inside and out. Don't take it personally and just stay out of her way. Oftentimes, the targets and even bystanders may fear retaliation. And we'll be talking more about retaliation further on in our presentation. Sometimes a workplace culture develops where unacceptable behavior becomes the norm. For instance, I'm sure many, if not all of you, have heard the expression, nurses eat their young. These types of comments unfortunately create a normalizing effect on behavior that's clearly unacceptable in a professional working environment. And when these types of behavior become the norm, they may no longer be recognized as something that needs to be challenged and addressed. And it can create a vicious cycle where those who were previously targets of bullying may end up bullying other staff members because there's an acceptance that that's just how things are done. There are many negative impacts of bullying on targets, the organization, as well as patient care. Impacts on the target could be feelings of sadness, isolation, and insecurity, decreased self-esteem, increased stress and anxiety, difficulty concentrating, increased absenceism, lower job satisfaction, increased illnesses, and that could be physical or mental illnesses. On the organization, it could be increased turnover and decreased organizational engagement, employees leaving the healthcare profession entirely, higher rates of absenteeism, injuries, and illnesses. And of course, there's also negative impacts on patient care. That could be improper, ineffective, or delayed treatment, adverse events, such as higher rates of injuries or illnesses, higher rates of patient dissatisfaction and decreased quality of care, higher rates of complaints or even litigation. In fact, it was reported in the previously mentioned survey that up to 70% of healthcare professionals felt that there was a direct link between disruptive behavior, medical errors, and poor quality of patient care.
So now this brings us to the very important section on addressing disruptive behaviors and bullying in the workplace. And at AHS, we follow an established model for addressing this type of behavior in the workplace. And for the target, step one is don't ignore the behavior. Address the behavior with the other individual as soon as possible. In most instances, respectful face-to-face discussion is the most effective and timely way to resolve the conflict and the issue. And just as this approach works best in our personal lives, it also works best in our work lives as well. It holds several benefits, including it will bring the behaviors directly to the attention of the other individual, and it will let them know their impact. It gives them an opportunity to change. The behavior may be intentional or unintentional, and a lot of times the person might not even realize the impact of their behaviors on other people. It's a respectful and a considerate way of managing conflict. The other person will likely appreciate being approached directly rather than getting another party involved right off the bat, or escalating the matter to a formal complaint, which can often result in a defensive reaction. If the behavior continues, you can demonstrate that you've already brought the behavior to the attention of the other individual and let them know it was unwelcome, and you also gave them an opportunity to change their behavior. It can then be more effectively followed up on by leadership. So if you remember the example that I shared at the beginning of the presentation of the situation that occurred with my supervisor, as I mentioned, I really regret not having brought that to her attention to explain how her behavior had impacted me. And what I came to realize later is that if I had approached her directly about this event, it would have I would have hopefully received some form of an apology, but also some constructive feedback. I could have shifted the outcome of that event from one of shame and regret to maybe one of reflection and learning. And that was within my power to make that shift. And what I've learned over the years is that most people will do the right thing if you give them a chance to. I've learned this because I've chosen to initiate some of those difficult conversations with people, and I never once have regretted having one of those conversations. You know, I've learned some different techniques and different approaches to use, but I never have regretted approaching someone directly. In my situation, my manager maybe had a bad day, or maybe she'd reached her limit with me. But either way, she likely never thought about that comment again. And I think that if I would have brought it to her attention in the right way, she hopefully would have reflected on it and not used that approach on someone else. I'm not excusing the behavior, but I know now that I have the power when something like that happens again to make moves on my end, to open up the lines of communication, to clarify the situation, and hopefully to resolve it. And we all have that power and the responsibility to ourselves to communicate our needs and expectations, and then it's really up to the other person to act on it. And so we want to talk about some suggested tips and approaches in having this type of conversation. First, be timely. Raise the issue as soon as possible from the time of the incident or the event. We all know that the longer you wait to address someone about disrespectful behavior, the less likely it is that you will actually address it. Let them know that their behavior is unwelcome, the impact that it's having on you. Stay calm, professional, polite, and direct. State factual and objective observations like specific incidents referencing the behavior and the impact. Ask the person to please stop what they're doing and communicate the desired behavior. The conversation should be conducted in an appropriate location, so definitely not in front of clients, patients, colleagues, or families. It's also important to model the desired behavior. So we can't force others to behave in a respectful way, but we can certainly show them how to. And of course, we've all heard this before, but use I statements whenever possible. So I statements help to focus on the behavior and not the person, and generally will cause a less defensive reaction. And so, although you can't see us right now, Colleen and I are going to do a little role play to demonstrate the differences between I statements and you statements. And it's going to be me addressing Colleen. Colleen, I want to talk to you about the project we're working on. I'm getting frustrated because you never meet the timelines you commit to. You always make excuses, and this makes me look bad. If you don't care about the project, then just tell me and I'll find someone else to participate.
I quit, Tara.
Yes, you can't see Colleen, but she's very angry with this approach. And so in this example, I obviously use a lot of generalizations, like you never and you always. I also make negative assumptions about Colleen's interest in the project. This approach will definitely elicit a negative or a defensive reaction, and we're not likely to come away with a positive resolution. So now I'm going to use a different approach with Colleen, using I statements and looking for common ground. Colleen, I wonder if we can have a chat about the project we're working on. I'm concerned that the last few timelines have not been met, which is impacting the broader strategy. I believe we both care about the outcome of this project and fulfilling our obligations to stakeholders. So I wondered if we could talk about how we could better work together to achieve our goal. Do you have any suggestions, or is there anything I can do to help support you? Colleen looks much happier with that approach. With this approach, I open it up by stating my personal concern, and I let her know how her behavior is contributing to this. I then try to establish common ground and communicate in a positive way my commitment to working together, and I also offer her my support. So we know that these conversations are not easy. They don't necessarily come naturally, and it's language that we don't normally use on a day-to-day basis, which is why we would suggest, to maybe write down your thoughts, to practice on a trusted colleague or a loved one. And once you've had one or two of these difficult conversations, they will become easier and less awkward. As the goal is to resolve the issue in a respectful way, there's really nothing awkward about that if you actually really think about it. So I'm going to provide you with a scenario involving some disruptive behavior and then some options for how the person should deal with it. Sarah and Dorothy are two seasoned RNs who work on a really busy unit. They're working together and it's been a hectic night, with both of them attending to multiple demands. Sarah needs help with a patient, so she approaches Dorothy in front of another patient to ask if she can help her with a procedure. Dorothy turns around abruptly and snaps rudely at Sarah that she's busy and cannot be at her beck and call. You're going to see 4 options on the screen as possible alternatives for Sarah to take, and we'd like you to reflect on which option you think Sarah should choose in this situation. A, speak with Dorothy at an appropriate time and location to discuss the impact that the behavior had on her. B, find another job. C, ignore the situation. Or D, bully back and give Dorothy a taste of her own medicine. So here's what Sarah ultimately decides to do. After reviewing some of the resources AHS offers, Sarah decides that she'll talk to Dorothy during their break. She approaches her when no one else is around and when Dorothy appears to be calmer. Sarah states, "Do you have a moment to talk about what happened today?" Sarah then uses an I statement to convey her concern by saying, "I was in need of urgent assistance today and I was embarrassed and hurt by the reaction I received." Sarah then tries to find common ground with Dorothy. "I know we're both really busy today and this is a very stressful environment sometimes. We both also want the best for patients, and I would have appreciated being treated in a more respectful manner." Dorothy apologized and stated that she was frustrated with other things that were going on and should not have taken this out on Sarah. She committed to being more respectful in the future, and she thanks Sarah for approaching her about this. So we know that a respectful and proactive approach like the one that Sarah took isn't always this effective. However, even in these cases, it's always better to try to first approach the other person to attempt to resolve the matter.
If your attempts to address these concerns are not successful, or there's a legitimate concern about your personal safety, the next appropriate step would be to raise your concern with your supervisor. If your concerns are with your supervisor, you should still attempt to address it with them first. If you do not feel safe addressing the behavior with them, you should report the behavior to either their manager or a local human resources advisor. If you're an in-scope employee, you can also contact your union representative for additional support. We want to note, though, that being uncomfortable about having a conversation with the other individual does not in and of itself constitute a legitimate concern for personal safety. All individuals hold a personal accountability to attempt to address these types of issues in the workplace. Some feelings of discomfort are actually expected in situations such as these because it's often uncomfortable to address workplace conflict. However, it's important to realize that escalating to a formal approach without first attempting to resolve it with the other person will result in additional relationship strain, which will almost certainly be more uncomfortable for all parties involved. Some individuals may also feel reluctant to address the matter based on fear of retaliation. At AHS, we will not condone any adverse action against anyone that reports improper activity in good faith. So if someone is experiencing retaliatory behavior as a result of addressing or reporting disruptive or bullying behavior, they should go report this to an appropriate management or operational leader or an HR business partnership advisor as soon as possible so it can be swiftly and appropriately dealt with. If none of these options are effective, our organization also has a confidential safe disclosure line that's available to staff. The AHS Workplace Escalations Matrix that's recommended in these types of situations is readily available for all our employees on our Insight page under How to Report Workplace Concerns. Once a complaint is initiated to management or HR, it will be reviewed to determine appropriate next steps. This review would first determine if there's an option to address the concerns, such as a mutually agreeable resolution between the parties. For instance, in some cases, an informal approach may be appropriate, such as a facilitated conversation between the parties, coaching, or training. However, for more escalated situations, it may require a more formal approach, such as a workplace investigation conducted by either the manager or an impartial investigation panel. Along with the above suggestions, we also have a few recommendations to help protect yourself moving forward. We would suggest learning more about bullying and the tools available to you in your organization to manage the situation, because information is power, and research has shown that taking training in conflict resolution, stress management, or communication techniques can be beneficial for individuals to effectively address and manage bullying behaviors. We also suggest documentation, because documentation can help you clarify the situation as well as relieve stress. In addition, documentation will be required in order to support a formal review, investigation, or other appropriate intervention processes if that becomes necessary. We would recommend documenting only the facts and keeping the information as objective as possible, but providing specific details of the steps you've already taken to try to resolve the issue with the other party and the outcome of those efforts, as well as including specific details, ideally in chronological order, of what was said and done, why was this improper based on policy and procedure, who may have witnessed it, the time and location, etc. And of course, access the help and support that you require. For instance, you may want to take self-care measures or access the resources and support that's available in your organization. At Alberta Health Services, we have an Employee and Family Assistance Program that provides a variety of free and confidential supports to all our employees as well as their immediate family members.
So we're going to give you one last scenario for discussion and reflection. Angela is a recent grad who worked on a unit for a little over 6 months. Since she started in the role, Laura, an RN with 20 years of experience, has repeatedly made negative comments about Angela that has caused her to be humiliated and to lose confidence. When Angela approaches Laura to ask her a question, Laura often lets out a loud sigh and makes her repeat the question numerous times, and then essentially barks a response at her. In addition, Laura often loudly points out minor errors and criticizes Angela in front of other staff, and sometimes even in front of patients. After one incident, Angela heard from another staff that Laura was laughing about the interaction, saying she had Angela shaking in her boots. On another occasion, Laura was organizing a baby shower for a colleague, and she did not include Angela in any of the emails or provide her with any details about the gathering. Angela found out about it through other staff, and when Angela asked Laura about it, she laughed and said, "Oh, I keep forgetting you even work here." Angela believes there's a pattern of behavior, and she feels intimidated, left out of social conversations, and isolated from the group. Due to Laura's charge role and years of experience on the unit, Angela is feeling vulnerable, and she's not sure how to address her concerns. As a result, she's having second thoughts about working on the unit, and she's actually wondering if she's cut out for nursing. So what do you think Angela should do? You'll see I'll read off the 4 options on the screen, and please reflect on which one you think is best for Angela. A, write an anonymous letter to the CEO about Laura's behavior. B, start a rumor about Laura. C, resign from the unit. Or D, approach Laura to let her know the impact of her behavior and request that she stop. Here's what Angela ultimately decides to do. She decides to document the behaviors as they occur. She knows that she will have to refer to this documentation if the situation escalates. As a first step, Angela approaches Laura about her behaviors because Angela would expect the same if someone had an issue with her. She's nervous about the conversation and afraid that Laura will begin to behave even worse if confronted, but she understands that she has a personal responsibility to attempt to address the matter. If the situation does not improve, she'll be in a better position to report her concerns to her manager. She takes Laura aside and asks her if they can talk privately during their break. She begins by saying, "I wanted to talk to you because lately I have felt excluded from social conversations, and it really hurt me that I was left out of the planning of the baby shower. When I'm excluded or spoken to in a derogatory manner, I feel targeted. I'm still new to the unit and trying my best to learn, and I could really use the understanding of support of my colleagues right now." Laura indicated she didn't even realize how she was being perceived. A few weeks went by, Laura seemed to be acting more respectfully, and then she began to revert to her previous behaviors. Angela then decided she would talk to her manager about the issue and to gain support in finding an appropriate resolution.
So it's often easy to recognize bullying and disruptive behaviors in other people, but not so easy to recognize our own behaviors. It's common for individuals to internally justify their own behaviors because they were either busy, having a bad day, maybe they weren't feeling well, etc. However, it's important that we all adhere to our code of conduct and values of our organization, which includes recognizing and appropriately addressing our own behaviors and contributions to workplace conflict. So if someone approaches you about your behavior, we have a few recommended steps. We would suggest avoid reacting defensively or downplaying or dismissing the concerns, because this will only create a power struggle and may further escalate the conflict. It might be beneficial to take a moment or a deep breath before you speak to avoid a reactionary response. You may also want to reschedule the conversation if you need to take a bit of time to think about the comments and reflect upon the situation before you're prepared to respond. For instance, you could thank the person for bringing the issue to your attention, let them know that you'd like to think about what they said, and we'll follow up with them shortly. However, the key is to follow through on your commitment to them. It's also recommended to acknowledge and validate the other person's feelings, because even if it wasn't your intent to upset them, it's still important to be empathetic and to acknowledge how they feel. Another tip is to recognize any mistakes and apologize. Anyone can make a mistake, but it takes a secure person to acknowledge it. It also takes a lot of courage for that other person to bring the concern to your attention. So it's important to give them an olive branch by recognizing your contributions to the conflict and apologizing for the impact your behavior may have had. Mistakes should be seen as opportunities to learn and grow both personally and professionally, and you can think about what you can learn from the experience and how you can change your approach in the future. And finally, resolve the problem by looking for common ground and working together on a shared solution. For example, you could say something like, "I think we're both very passionate about patient care, but may have a difference of opinion from time to time on how to achieve a common aim. I'd like to work with you on how we can more effectively manage situations like this in the future. Do you have any suggestions?"
So we want to emphasize that addressing disruptive behavior and bullying in the workplace is everyone's responsibility, and we all have a role to play in creating safe, healthy, and inclusive workplaces. Every individual has a personal responsibility to both engage in respectful behavior towards others and appropriately address bullying and disruptive behavior when it does occur. And this includes witnesses and bystanders. So bystander inaction is often seen and can often be seen as a show of support for the bully. Sometimes people are fearful that if they stand up against the behavior that they might be the next target, by doing nothing you're actually contributing to the ongoing bullying and the negative workplace culture. It's important not to take a passive role as a witness or a bystander. So even acts of support can mean the world and act as a lifeline to someone that's being targeted. And it might even be a simple act as physically standing beside the person as a show of solidarity when someone is attempting to bully them. You can also model the behavior and culture that you want to see in your department. So if they go low, you go high. It's important to recognize that silence is condemnation. To say that you all work in a stressful environment is a huge understatement. And that's why it's so important to look out for one another and to be able to lean on each other for support.
In many cases, the person being bullied or experiencing disruptive behavior feels isolated and vulnerable, especially when colleagues witnessed the incidents and said or did nothing. Some suggestions for addressing disruptive behaviors or bullying for witnesses would be to confront the behavior appropriately when it's personally experienced or when observing others being targeted. So speak up and say something. This shouldn't be confrontational. Ideally, the comment should help to de-escalate the situation. For example, you could say something supportive to or about the target, or change the subject by redirecting the conversation to be more appropriate and professional. You can ask the target if everything is okay and if they need any assistance. Another option is to help the target get away from the situation until calmer minds prevail. For instance, you could say something like, "I'm so sorry to interrupt, but I need to borrow Jason right now for an urgent matter." You can also approach the perpetrator afterwards in private to ask how they're doing and to say something like, "Hey Anne, I'm a bit worried about Betty. I think she may have felt hurt and embarrassed by some of the comments that were said in the lunchroom today. She's new to the unit and just trying to learn. We've all been in her shoes at some point in our career, and I think she would probably appreciate an apology and additional support." Comments such as these can go a long way to support all parties involved. It's also more likely to go over better than a direct confrontation in front of others, which is more likely to entrench someone in their position or serve to escalate the behavior. We'd also suggest appropriately supporting and advocating for colleagues who are targeted in a professional and discreet way. So in other words, don't display the same behaviors you're trying to prevent. You can do this by offering support and encouragement to the individual. Let them know what you saw, what was happening, and that they don't deserve to be treated that way. Be supportive and ask if there's anything you can do and listen to their concerns. Inform them about the resources available and the recommended organizational model for addressing these types of concerns. And make an effort to reach out if you see someone struggling at work to provide them with a smile or a kind word. Giving someone a compliment or requesting their opinion can make a world of difference by showing the target that they're valued and not alone. It's also more difficult for people to be targeted when they have a visible and active support network. Small acts of kindness, respect, and inclusion from bystanders can help take the power away from the bully. It also empowers others and helps to shift the workplace culture, and the ripple effect of your actions can have a very dramatic impact. We'd also recommend not participating in rumors and gossip, because rumors and gossip often spreads false information that can contribute to workplace bullying. Even if the rumor has a kernel of truth to it, everyone has the right to privacy, and details of their private life should not be shared without their consent. So before you pass on rumor or gossip, stop to consider the impact on the target. You may want to consider comments such as, "I've always had a good working relationship with Jane, and I'm just not comfortable talking about her while she's not here." And finally, we also suggest challenging that's just who they are and that's just the way things are mindset. Because there's often a culture of tolerance of abusive behavior in the healthcare workforce that can create a vicious cycle. Previous targets of bullying may end up bullying others, as we've mentioned, and it can create a vicious cycle because the behavior is learned. And that cycle of abuse will continue time and time again unless we all take a stand against it. We'd also recommend documenting the behavior when it threatens individual well-being, patient care, or service delivery, and reporting appropriately and in a timely manner, because we all have the power to take a stand against bullying.
AHS takes bullying behaviors very seriously, and we will take appropriate action to address reports of workplace violence, which includes bullying. We've developed policies, procedures, toolkits, training, and other resources to address violence in the workplace with the goal of creating a psychologically safe work environment. This also reflects our AHS values of respect and safety, which guide how we work together with patients, clients, families, and each other. AHS is also committed to providing respectful and supportive work environments to ensure the safety and well-being of all individuals. And this commitment supports the priority under our people strategy to create a safe, healthy, and inclusive workplace. As mentioned, AHS has developed many tools and resources for both employees and managers to address bullying and disruptive behaviors in the workplace. Some of these include the Respectful Workplaces Guide, the information on how to report workplace concerns, bullying toolkits for employees and managers, and the Workplace Violence Prevention and Response Policy. These resources and many others can be found on Insight under Health and Wellness and Respectful Workplaces. AHS also offers training through My Learning Link, and as mentioned, a variety of different online resources on psychological health and safety and bullying, as well as many different training and reading resources through our Employee, Family, and Assistance Program on this topic.
This leads us to the end of our presentation, and we know that we went through a lot of information today, and we want to thank you for taking the time to join us on this very important topic on this very important Awareness Day. Thank you so much for